Welcome to Three Questions in 3 Minutes, where we sit down with education leaders across the state to discuss the blueprint for Maryland's future. Today, we are joined by Hernande Altima, Policy Director of Special Populations at the Mental Health Association of Maryland, and our co-chair for the Coalition for the Blueprint for Maryland's Future. Hernande, thanks for joining us today. Please tell our listeners about yourself and the work of the Maryland Mental Health Association.
Thank you for having me. My name is Hernande Altima. I am the Policy Director of Special Populations at Mental Health Association of Maryland. At Mental Health Association of Maryland, we are a consumer advocacy group. We are the statewide consumer advocacy group for all those families and individuals that access the behavioral health system. And we've been doing so for over 100 years.
Fantastic. So can you tell us a little bit about what was at stake in the Blueprint for Maryland's future for the populations that the Mental Health Association of Maryland serves?
Absolutely. We at the Mental Health Association of Maryland have plenty of coalitions, and the one specific to this issue is the Children's Behavioral Health Coalition. The Children's Behavioral Health Coalition has been advocating for quite some time for the insertion of school behavioral health services in our schools. We've kind of missed the boat. We've been left out of the conversation, but the blueprint invited us in, and we wanted to make sure that the best practices were part of the blueprint. And the blueprint, as passed, did that. They included us in the conversation. They talked about training school personnel and identifying the mental health issues that may be in a student that might be limiting their ability to learn, might be limiting their ability to interact, and also delivering their full potential as a student. The other part about that was that it was going to have more money for community providers. That's important because I think people do not recognize the value of having community providers that are connected to the schools. And when they are connected, they can work outside of the school when school is not in session to continue to grow and inform, and as well as help the family that needs that assistance to get that child to be able to perform to their full potential when they're not with their provider.
Mm-hmm. Those sound like really critical services. Finally, what message do you have for lawmakers in the General Assembly with regard to the blueprint?
We need to override the veto. Lawmakers need to do this because families are asking for this, the students are asking for this, and what this does by overriding the veto, it unlocks the services, school behavioral health services that we are so dire to those communities, to those students that really need it. That is the role of a lawmaker, to unlock whatever barrier is in their way for communities. And by overriding the veto, that is what lawmakers will do.
Yes, brilliant. Thank you so much for that, Hernande, and thank you for the great work that you and the other staff at the Mental Health Association of Maryland are doing to support educational equity here in the state.